COVID-19 in Colorado now. There are now 300 fewer ICU beds available in the state than this time last year, despite a decrease in the number of ICU patients. Chief investigative reporter Chelsea Brensel is live to explain how hospital staffing shortages could play a role. Chelsea.
Heather, right now, Colorado hospitals are operating with 300 fewer ICU beds than they were last year. And we know the issue may only get worse as 25% of hospitals reported to the state they anticipate an ICU bed shortage within the next week.
We are down to 149 ICU beds across the state.
That's what Governor Jared Polis said last week while urging Coloradans to get vaccinated against COVID-19. Polis said it was the fewest amount of available ICU beds in Colorado since the pandemic began. But 13 Investigates has learned the bed shortage correlates with hospital staffing. On October 11th, 2020, there were more than 1,500 ICU patients using 79% of the available ICU beds. Compare that to now, where under 1,500 ICU patients are using 90% of the ICU bed capacity. State data shows Colorado hospitals are currently operating with 309 fewer ICU beds than they were a year ago. A spokesperson for the Colorado Hospital Association tells 13 Investigates the ICU bed count decline is likely due to staffing shortages across the state. The association says it's also possible the ability of a hospital to surge more space for COVID-19 patients has declined from other spikes during the pandemic. Many hospitals have previously reported being busy with early respiratory virus season and summer trauma patients. 35% of Colorado hospitals told state health leaders that they anticipated a staffing shortage in the next week. Meanwhile, hospitals are urging folks who need care to seek it immediately, despite the capacity concerns. Reporting in the studio, Chelsea Brensel, 13 Investigates.